Hi and welcome. I am trying to learn medicine. Today is circulation problems in the eye. And after we've done that, we're going to do standing yoga. And if you're participating in standing yoga, then it's at your own risk. And we're talking about diseases and internal anatomy and internal eye anatomy. And this is no medical advice, we're just learning about it. Circulation problems in the eye. The vision can be affected by hemorrhages or clots that block the blood vessels of the retina. High blood pressure or diabetic increases the risk of this happening. Okay, let's read on maybe the symptoms, but no, let's first understand it. Then symptoms for clarification. Okay, there can be hemorrhages, I don't know really what it is, and clots and they're blocking the blood vessels of the retina. So the retina is somewhere in the eye, I don't know exactly, and the retina is supplied by blood vessels, and they can be blocked because of clots, or hemorrhages can also disturb them. And people with high blood pressure or diabetes have an increased risk of having it. Symptoms. Blockage of the circulation to the eye can cause sudden, painless loss of vision in one eye. Sudden, painless loss of vision in one eye. If sudden blindness is total, it is probable that an artery has been blocked. If a vein is blocked, the loss of vision is likely to be on. Oh, but that is so interesting. Maybe we should read the sentence. Well, if a vein is blocked, the loss of vision is likely to be only partial. If an artery is blocked, so if there's sudden blindness, then it's probably an artery delivering the blood to the eye. And if it is the blood going away, it is just partially. It makes absolute sense, but it's so fascinating. If a circulation supplying the central retina becomes inefficient, or if there is bleeding in this, sorry, talking also about blood system, or if there's bleeding in this area, the patient will gradually find it increasingly difficult to read or knit or do find work. Do we talking about seconds, minutes, hours? Because we had said here sudden blindness is total and can cause sudden painless loss of vision. And this sounds a bit differently. If a circulation supplying the central retina becomes inefficient, or if there is bleeding in this area, the patient will gradually find it increasingly difficult to read or knit or do fine work. Small, symptomless hemorrhages may also occur in people with high blood pressure or diabetes. Oh, okay, whatever that means. Duration. The speed and extent of recovery depend on the size and area of the damage to the retina gets damaged to the retina. A degree of recovery of sight may occur over a period of a few weeks or months. Okay, we're talking about something differently. We're talking about that the recovery may happen over weeks or months. Causes. The small hemorrhages which can occur with diabetes or high blood pressure are part of a general strain on the circulation with which these conditions can cause. We're listening if there's anything mechanical can do it. Okay, hemorrhages can occur through diabetes or high blood pressure because of a general strain onto the whole circulation through diabetes and high blood pressure. Blood vessel blockages are usually caused by small clots which may form in arteries affected by ephemeroma or in veins crossed by small hardened arteries. Wait a second. Blood vessel blockage are caused by veins crossed by small hardened arteries. We had it in one of the previous parts that a muscle, where it was written that a muscle can shut off, or there's no proper term, shut off a nerve, that a muscle can impinge a nerve. And now we're having here arteries, the arteries are hardened, and now affecting the blood vessel. And also after a while, I want to go back, I don't really know what it was. A degeneration of the walls of the arteries. A degeneration of the walls of the arteries. The condition is also known as atherosclerosis and arteriosclerosis. Fatty deposits develop on the arteries walls which, when hardened, produce the condition known as sclerosis. Did we do it? We must have done it. But we haven't done our presentation, so we're not done with it. We're going to come back to that later. 115. When to consult a doctor. If you have any loss of vision, especially sudden loss of vision, seek medical help immediately. What the doctor might do. The doctor is likely to test your eyesight by means of an eye chart, test your field of vision, and look in your eyes with an ophthalmoscope. He or she will also probably check the blood pressure and test the urine for sugar. Because of diabetes, because when the sugar content is high, when people have diabetes. If the vision has been lost suddenly, why is it? It is because the diabetes, what was it now? What was it? There's one organ. That one organ isn't sending out the insulin, but it is, and the liver isn't reacting to it. What was it now? I'm going to come to the back to it later. I have made a video about it separately. If a vision has been lost suddenly, the doctor will almost certainly arrange emergency admission to an eye hospital. Okay, up to an eye hospital is one side. When a retinal artery is blocked, high doses of steroids, cortisone, may be needed to save the sight of a second eye. If a vein has been affected, the eye dies. I don't know if it's if a vein has been affected, tests and sometimes treatment will be needed to prevent the development of chronic glaucoma. When a retinal artery is blocked, high doses of steroids, cortisone, may be needed to save the sight of a second eye. Are we connected? I want to now know more about the blood supply of the eyes. Would it be interesting if I had my own blood? Would it not be very helpful for the brain if the brain would be also paired and if both had an individual blood supply? If a vein has been affected, tests and sometimes treatment will be needed to prevent the development of chronic glaucoma. We are by C, we haven't done glaucoma yet. Prevention. Do not smoke. There is evidence that hardening of the arteries, the underlying cause of most circulatory problems in the eye, may be associated with heavy cigarette smoking. If you suffer from high blood pressure or diabetes, it is vital to continue under medical supervision. Whatever, if I don't get the sense. If you suffer from high blood pressure or diabetes, other underlying causes, it is vital to continue under medical observation, under medical supervision. Outlook. Even if the sight of the affected eye cannot be saved or can be only partially restored, it is quite possible to adapt well to sight with one eye only. If the central vision is affected, reading may become impossible, although the patient will not go blind and will be able to see his way to get his or her way to get about. If the central vision is not affected, oh yes, because it could also just have partial sight. That's one bit. And the patient can do most tasks not requiring fine vision. It's an infarct of the eye. It is not some little thing, it's an infarct of the eye. The eye doesn't get blood supply, and the retina dies, and the person gets actually blind. And now there could be then cortisol or steroids to save the other eye from going blind. And it can. And yes, so basically blood infarct of the eye with drastic consequences to the eye, as it is an infarct of the heart and brain, with possible death of the eye. And that is caused, the only causes here meant are high blood pressure, and its causes then probably, and diabetes. Now, that was the medical part. Now we're going to do yoga. If you will be here for medicine, you can go to the next part of medicine. I still don't know who it was for medicine. If you were for medicine, go to the next part of medicine. We're going to do now the standing yoga. If you still participate in the standing yoga 5 minutes, then it's the office. Go to step, it's not a good step, it's have feet step together with breathing in it. And breathe out the arms again out. In the arms up. arms down. Again, in the arms up. And out. Again, the arms up. And out the arms to the side. In the arms up. Out up and to the other side. In the arms up. Making a space between your feet and out of the side. In the arms up. And out of the sinking down into half chair. Breathe in and come up. Out open to one side. In and up. Out and down. In and up again, cross the feet and lean back, pull the shoulder blades together. In and up. Out and lean back, pull the shoulder blades together. In and up. Hands to touch and lean back, breathe out. In and up. And out and lean back. In and up. And out over to one side. In and up. And out over to the other side. In and up. I'll cross the arms and the 12 fingers to each side. Without reaching from out of the back. In and up. Change the other crossing into 20 fingers with each side. Breathe in. Out reaching from out of the back. In and up. Out of the arms down and leaning onto the knees, making an inch space between the toes. Breathe in. And out. Make a head of the backward cat. Breathe in. And out. And the lid of the backward cow. Breathe in into the middle. And out the head. Again in. And out. Belly. Again in. Now we come with our own back slowly up. Now we lift the arms up. Out open to the side. In the arm. And now out the arms over the sides down into the chair. Breathe in, come halfway up. Come high up. And out and coming up. Breathe in each side. Out open to the side. In and arms up. And out again down into the chair. Breathe in, come halfway up. Higher up. And out and we're coming up. Now we're in and come up onto the toes. And we're out and we're sinking down. Breathing in and come up. And out and down again. In and up. Now out and down, the arms over the sides down, feet again together. Breathe in, bend the right leg. Breathe out, stretch just the left leg. In and change. And out and stretch the right leg. In and change. And out, stretch the right leg. In and change. And out, stretch the right leg. In and change. And out, both legs together. Breathe in, lift the right hand up to the sky. Breathe out with the left knee, look over the right shoulder to the right hand. With an arm again in. And out and down. Breathe in, lift the left hand up to the sky. And breathe out with the right knee, look over the left shoulder to the left hand. Breathe in and down again. Out and down. Make a hand with space between your feet. Shift the weight to the heels. Breathe in and come down. And out and come up. And in and down. And out and up. And in and down. And out and up. Take hold on the elbows. And gently swing from side to side. And arms again down, feet together. And breathe in, come halfway up, straight back. Out and down. In, halfway up. Out and down. And breathe in, come up again. Hands together and again down. Now make feet standing shoulders wide apart. Intertwine the fingers behind the back, turn up. Shoulders back, breathe in. Out, head over to one side. Chin down to the clavicle. Pull the arm and the shoulder down. Breathe again in. Lift the gaze and the head over to the other side. Hands also over to the left side. And chin down to the clavicle. And pull the arm and the shoulder down. Again in, lift the gaze back into the middle. Have the feet staying together and breathe in with your arms up. Lift out and lean back. In and arms up. Out, lean back. In and arms up. Out and down. Breathe in with your arms up. Bring the hands together and lower them down. It was the same way. Thank you very much. Thanks for listening.